Now, Rhode Island is actually the third state in the nation to make it mandatory. And we've brought in Dr. Jim McDonald from the Rhode Island Department of Health. We really appreciate you joining us, Doctor.
Thank you. Good to be here.
So, I mean, just kind of tell us first the reasoning for making this mandatory.
Well, HPV is very common. We're talking about a virus that's going to infect almost everyone at some point throughout their lifetime. And it leads to a very serious disease, cancer. Cancer is important to prevent. We've worked with the physician community, and you know, this regulation was actually created last year, but it's being phased in and implemented this year. Rhode Island, like other states, incorporates the CDC recommended vaccines. All of our other vaccines have become mandatory. It was time for this one to become mandatory. Cancer is important to prevent. I wish we could prevent every cancer. We can't, but right now we can prevent cervical cancer, and this is an important thing to prevent.
Now, Rhode Island, though, is the third state to do it. It's not like every state has done this. So why was it important, do you believe, for the Department of Health to make this move now, to make it the third state to do this and jump ahead?
Well, Rhode Island actually does lead the nation in vaccines. We're one of the best immunized states. I think we get prevention well over here in Rhode Island. We understand when you can prevent a serious illness, you should. It's the right thing to do. And we're talking about preventing cancer. We're talking about preventing cervical cancer. It's a life-threatening disease, and it's an important disease to prevent. This vaccine's been around since June of 2006. It's not new, but we know it's safe, and we know it's very effective. I'm not just a doctor, I'm also a parent. My 3 kids have gotten the vaccine. It's that important.
Does it cost parents money?
You know, it's a great question, and really in Rhode Island, we're a universal vaccine state. We have a program called Vaccinate Before You Graduate. You know, insurance companies might have different co-pays. Someone has Medicaid or is uninsured, it can be given at no cost to them. And there's even, we go into the schools, and it'll be in the schools where you can get it at the school, but no child will be turned away because of inability to pay. It's that important. We want to prevent cancer as best we can.
Really appreciate the information, Doctor.
Thank you
so much for coming in. We do appreciate it. And also, this discussion does continue on our website, WPRI.com. The state will hold 5 public hearings as well in August, provide information to parents and to answer questions. And we're posting more details on our website about the hearings and what you need to know about the requirement. Just go to WPRI.com.